Good morning, everyone. Welcome to our Saturday plenary on healthcare, social media, and digital strategy. So thanks for coming in on this early Saturday morning, hopefully not too early. We are going to discuss the ever-changing intersection of healthcare and the digital world that so many of us are curious about and most of us are a part of. Today you're going to be hearing a lot about how new tools and how technology are influencing and hopefully enhancing our ability to mobilize our audiences around healthcare, our healthcare advocacy efforts. Actually, last night Ron Pollock, our executive director, and I were talking about today's plenary, and he made a joke and he said, "Hey, you're going to be talking about fax machines, right?" And I said, no, it's about the mimeograph machine. That is the new technology. So some of you may laugh at that and others have no idea what I'm talking about. I'm right in the middle there. But we had a laugh, but in all seriousness, it did get me thinking about the importance that we all place on digital strategy today. We think of it, some of us are maybe slightly intimidated by it. Some of us are intensely curious. Some of us are maybe have been early adopters. And so what is this thing that we call digital strategy? And I could probably give you a technical or a textbook definition, but I actually won't. Instead, I just want to reiterate what you probably already know, which is that the importance of digital communication is just simply that. It's to communicate. That hasn't changed. And today we happen to be doing it with different technology than we did even 10 years ago or 15 years ago or longer. So we use that technology to improve our communication, and that really is how things have changed, and that's part of what we want to share with you today, and hopefully get a lot of your questions about that. But the conversation between you and your audience remains the same. Your goals are still the same. You want to engage in a dialogue with another person. You want to get your message across, and you want to inform them, and you want to pursue, or you want them to pursue, a call to action. That's kind of a timeless thing. That hasn't changed. So the difference that you'll hear about today is how now we can use this different technology and those different channels that you keep hearing about, the channels of communication, these digital channels that comprise our digital strategy, to essentially do what you're doing already, which is you're evaluating your message, you're evaluating your audience, you're determining how effectively you're getting that message across, and as important, what the audience is doing with that message. And I'm really excited to have some really good panelists here that'll share good techniques on how to do that. So our panelists today include Susanna Fox, and she's currently with the Pew Research Center. Susanna's going to kick things off with a short presentation on the landscape of social media today. So hopefully she'll be answering a lot of your questions about social media. Who is using social media? Where are they spending their time? And I think, as important, how that plays out in the context of healthcare today. And then next we're going to hear from Regina Holliday. She's a very talented artist. You may have seen her painting in the back, and Jen Beeson has been talking about that during the conference. She is a very savvy user of social media and technology to motivate and engage a wide variety of audiences, including doctors, but on a very personal level, and you're going to hear more about that. Some of you might even recognize her as a familiar face. She's actually a member of our healthcare story bank. And then for those of you who don't know her, in addition to being an artist, she's a healthcare activist, and she's a speaker, and she's an author. So she'll talk about how she's using technology and social media to help change the landscape of medicine and the interaction with patients. And finally, we're fortunate to have with us Larry Swader, who's the Director of Digital Media at the National Campaign to Prevent Teen and Unplanned Pregnancy. And as you'll learn from his thoughtful tips on best practices for social media, Larry has spent much of his career studying and really applying effective techniques for engaging audiences in the world of social and digital media. So those are the folks you'll hear from today. Before we kick off our presentation, just a quick note on logistics. We want to keep things as short as possible to give you the opportunity to ask as many questions as possible. So you'll be hearing first from our three speakers. They'll speak for about 5 or 6 minutes, and then we're going to open up the floor to questions. There's mics on each side of the room up front. Simply just walk up to the mic and ask your questions. And then because this is about social media, we ask if you're interested, you can also tweet your questions out. You'll be using the hashtag that you've been using during the conference, which is HA2014. So just go ahead, tweet those out, and Megan will be monitoring Twitter, and she'll be bringing those questions up. So with that said, let me welcome Susanna Fox.
Thank you very much. And I think my slides are going to come up. There they are. I work at the Pew Research Center, which is funded by the Pew Charitable Trust. We're a nonprofit here in DC, and we study the social impact of the internet. And my specialty is studying the social impact of the internet on health and healthcare. We collect data, mostly through survey work, but also I do field work in patient communities. And I would have to say that one of the most popular uses of our data is in grant proposals and in letters and pitches to team leaders and to colleagues, hoping to convince people to start using social media. So what I hope to do today is empower you with data to bring back to your colleagues, maybe to convince a funder to invest in some infrastructure that'll help you take advantage of all of the new platforms that we're going to talk about today. But first, I have a confession to make. I actually pulled a trick in preparation for this presentation. I started the conversation on Twitter a week in advance, and I actually got all of my friends on Twitter to do most of the work for me for the presentation. And it turned out to be an example of how you can use social media to inject the public conversation with messages that you want people to talk about, and again, to get other people to do the work for you and to learn and listen from them, which is what it turned out to be for me. A week ago, I sent out a tweet saying that the Pew Research Center has new data on the demographics of social media. That's where I injected our data into the public conversation. And I asked people for examples. And I got examples from all over the world, more than I could ever possibly use. And I put 25 slides together, more than I'm going to be able, frankly, to get through in 5 minutes. But that's because you guys aren't really my audience. I'm really glad to be here, and I'm really glad to share what I know with you here in person today. But over 1,200 people have already looked at my slides on SlideShare. And many more people have looked at the tweets and at the data that I've shared on Twitter so far, and that is going to continue to spread. So this presentation is only the midpoint of the conversation. It started a week ago, and it's going to continue on. And so now let me get to some of the data. Whenever we're talking about the internet, I always want to start with who has access, and to hopefully make you feel a little bit better if you're not sure that this is for you. Not everyone is online. It's now 85% of American adults. People who are older, who are living with a disability or with a chronic condition, are less likely to be online. We're mostly seeing that the digital divide in terms of race and ethnicity is disappearing thanks to mobile. We now see that about 9 in 10 American adults have a cell phone, and 6 in 10 of those are going online using their cell phone. And social media is perfect for that mobile platform. So much of what's going on is being done on mobile phones. This is probably the most important chart that I'm going to show you today, because it really puts into perspective the dominance of Facebook. It's really sort of the meeting place for most people. And I'm going to go into all the other platforms, but it's just important to keep in mind that you might see headlines where people say Facebook is dying, et cetera. That's not what we see in our data. It still is the #1 social media platform. And again, you can make your decision about your audience based on the demographics that I'm about to share. But just keep it in mind that Facebook is still very dominant. So when I ask people about Facebook, and this is another example of how the demographics are quite different in terms of social media use. If you're looking for a younger audience, you're going to find them on these social media platforms. If you're looking for an older audience, it's going to be less likely. So my examples came from the crowd, and what we see is that there's all kinds of ways to use Facebook. People use it to raise awareness, people use it for campaigns. I loved this tweet that I got from a lactation consultant in the UK. And as she put it, she said, this is where we need to be, because this is where moms are. Facebook is especially popular with women. It's especially popular with 18 to 29-year-olds. And after each of the examples, again, this is for SlideShare for later, you can look at the demographics of each platform. Moving on to LinkedIn, it's especially popular with men and people aged 30 to 64. It's also a platform that's popular among higher income people, which is something to keep in mind. You might use it for networking. The example that I ended up using is a digital health group on LinkedIn, which has over 22,000 members, and they're exchanging information every day. The next platform that we're looking at is Pinterest. Again, it's very popular with women and popular with internet users 18 to 49. It's a wonderful place if you are an organization that has a lot of visual material, or you want to give people ideas and inspiration, like the Crohn's and Colitis Foundation of America is doing using Pinterest. The next example is Twitter. And I say that because that's my favorite. It's especially popular with 18 to 29-year-olds, with urban internet users, and with African American internet users. And again, it's a way to engage in a conversation. Sometimes I think of a hashtag like a spotlight. And if you tag your tweet with a spotlight, you're sort of taking a twirl on stage and hoping that somebody is going to see it. And you can build your audience and engage with them just through short messages. Instagram is another platform that's important to keep in mind if you have material that is best expressed visually. It's especially popular, again, with 18 to 29-year-olds, African Americans, Latinos, women, and urban internet users. The next platform that I'm going to look at is YouTube. And, you know, YouTube swamps Facebook. And I put it on as a social media platform because what we see in our data is that it is quite social. People are sharing these videos. And as Wi-Fi and broadband continue to spread throughout the population, people are using more video, they're trading videos. One of the surprising things that we found in our study is that educational videos are very popular across the board. So again, YouTube is a great opportunity for a low literacy population. It's, again, very popular with young people, but there's an opportunity there for all internet users. Some of the material that I'm going to show, we actually don't have data on. We can't collect data anymore on blogs because they're so ubiquitous that people don't really know what we're talking about, but it's, again, a social media platform to consider. One of my Twitter followers and friends said to be sure to include SlideShare. And of course, that's essential, especially if you have a lot of data to share and you want to reach new audiences. Storify is a way to capture tweets and to tell a story with all the material that you're sharing. And finally, Tumblr. Tumblr is especially popular with 18 to 29-year-olds. It's a very visual platform. And what I was really struck by is the way that it is so participatory. And to me, social media is as much a listening tool as anything else. I loved this example, My Diabetes Secret, where people can put something that they wouldn't tell anybody else about what it's like to live with diabetes. And it becomes a wonderful sharing platform. I also really like the way Planned Parenthood uses it as a Q&A. So they are able to learn from the people formerly known as the audience. And they're also able to answer those questions in a way that is very open. So it's a wonderful way for social media to expand what we're looking at. Now, of course, I didn't go into every platform, and you might have a favorite that I didn't name. But we have data at Pew Research to empower you in what you'd like to do. And I would just invite you to think about your goals, about whether it's communication, for organizing, for learning, and to think about how you can use your data, our data, to set your sights and make your strategy even more powerful. Thank you.
Well, I was endowed by many talents in my life, and one of them was not height. So I don't speak behind podiums because I've actually not been seen before, which is just horrible if you're giving a speech. Now, why I'm here to talk with you today is about the intersection of art and social media and how powerful it is if you have the ability to take images and spread them. Because human beings, guess what? They love images. They're powerful, they connect to their soul, and they speak to people in a way that words could never do. So I want to take you from what a lot of people perceive art to be, a pretty picture, and take it to something else. So art, that's for little kids, right? I mean, I get that a lot. Oh, you work with hospitals, you must go in the craft cart and help those little children out get to do art. Well, first thing, art's not just for little children. Art's for all of us, right? Especially if you're sad or unhappy, it's one of the best ways to get out what's inside of you, but art can do so much more. See, I know a lot of people in this room and know more deeply one person on the stage because of something that happened within my own life. In 2009, my husband was diagnosed with kidney cancer and was hospitalized in 5 facilities continuously for 11 weeks. And on the 12th week, he died. Now, the number one problem we had when my husband was hospitalized was a lack of access to the electronic medical record while hospitalized, which I thought was so wrong because you can get to your bank statement, right? You can get to all other information in your life, but that very, very important information that should be accessible to you in the hospital. So I thought, how can I spread the word through the entire nation of how incredibly important it is that we change this? I thought, I can paint a 17 by 70 foot mural of it in Washington, D.C., okay? On Connecticut Avenue. So that's what I started to do. And if you look at that picture right there, I'm painting on that mural. And I'm painting on it, and it didn't cost a lot of money. It cost about $500 in paint supplies. The wall was donated for free. My church gave me a ladder, okay? And it blew up. And one of the reasons it blew up, because 12 days after my husband died, there was an event on Freedom Plaza, and there was a booth at that event, and that booth was Families USA. And I walked up to the woman who ran the story bank and said, I have a story to tell you. And she said, thank you. Now, I will tell you, as a new widow, you're almost like an open wound. The grief is so raw and so pure. There are people who will not talk to you anymore. But Families USA talk to me. And I will always, always have the deepest gratitude to them. The other people that will talk to you is people who will talk to you while you're painting. You'll notice I have an easel in the back of this room. Several of you have come up to me and just started talking to me, and you don't know me from Adam. And the same thing happened to me when I was painting on that wall. And the first people who speak to you are the broken people, the people who are mentally challenged in some way. And then finally you become normal and regular people start talking to you. Yeah, it's pretty amazing. And then finally, guess where you're talking about it? I'm not just writing on a wall in reality, I'm writing on a wall in the internet. I'm spreading the word of what's going on within healthcare to thousands of people, and I'm doing it digitally. See, this is what occurred to me when I was painting. It first got picked up by people on Twitter. I became friends with Susanna Fox in the digital world. I was already friends with Susanna Fox because I worked at the toy store she shopped at. But it was great to know the 2 Susanna Foxes. And then I started blogging, and I started tweeting, I was Facebooking, and then Storybank started coming to me, asking me questions, and then I got to be talked with the regular media on ABC and NBC and BBC, and finally we were in the BMJ, which was spectacular. There are doctors who wait their whole life to get in the BMJ, and I got in there in 10 weeks. That's art, people. So it's powerful. So what continued on is we just got this ball rolling. And then I got to speak before a subcommittee and a Senate conference about healthcare reform. And then I got to testify at a meaningful use subcommittee about how the law must change and patients must have access to data. So this is the painting. It's called 73 Cents. It's huge. It's right by Politics and Prose here in DC. I highly recommend you see it if you can. And what that mural did is it was just amazing because every day people go up to it and see it, and just like the internet, it advocates 24 hours a day, and you cannot tell a wall to shut up. And that's what your wall in reality in your digital world will do as well. Now, I didn't stop there. So I painted this really big painting, I was still blogging and tweeting, and then I learned out about there's this thing called HCAP scores, okay? So I heard there was this competition where they even invited artists to paint about data. I was like, yes! And so I started painting about data, and I painted about George Washington University Medical Center. And if you look at the clouds in that sky, that's clinical data scores for that facility, and they're amazing. They're in the 90 plus, okay, for the clinical side. But if you look at that child holding a report card, as of 2010 data, their patient satisfaction scores ranked in the C's, D's, and F's. Now, where did I paint this painting? In front of the hospital. It was amazing. It was like being the internet, okay? So I was there painting, the data stream was flowing by me. Occasionally I get a hit. People would stop, what in the world are you doing? What are you painting? And I was explaining HCAP scores to pedestrians. It was spectacular. And then somebody came by, she was very nicely dressed. It turned out she was on the board of directors for the hospital. She's like, where did you get this data? I'm like, it's free and available online. So, next thing happened, there was going to be Body Shock the Future, another competition that I was learning about these things that are online. You don't always win. Most likely you will not win, but better visibility, great? So I decided to paint about something that could drastically change the entire country really rapidly if we did something about it. And that was the bedside tray table is used for food and incontinent bedding changes, and is not cleaned between uses. And this is happening every day all the way around the country. If this one thing was changed, we would have a major drop in C. diff problems throughout the country. So this is what I painted about, and this got an honorable mention, and it went on tour throughout the United States. The concept did, and that spreads the word of what we do. So it didn't just stop there. I got invited to a meeting here in DC. I love DC. There's so many free public meetings here, and we get to go to them and they can't keep us out of the door. It's amazing, but sometimes there's private ones you're not invited to, and one of those private meetings was Partnership for Patients campaign. It was the kickoff meeting in June, and no patients were actually invited to the kickoff meeting of Partnership for Patients. So I got an invitation 24 hours before the event from two of the attendees, could I please come? And I said, yes, I could come, but I would love to paint in the back of the room. Okay, they said, we'll let you do that. So I was there and I was painting and I was listening, and Don Berwick came in, he was running CMS at the time, and he's like, Regina, and I'm like, Don! And he said, are you getting to speak today? And I'm like, no, I'm not. And he ceded 7 minutes of his speech to me, so I could speak, yay, Don. So I did this, and then this kickoff meeting happened, and we were so excited. We were going to change the world. And then nobody called me for a year. And I'm like, what happened to the partnership with patients part of the for patients? And they said, well, we're going to get to it. And and they didn't get to it for very long time. So then we had a call. We had a phone call because there wasn't money for patients to come to the meeting. So we had a phone call, and as the phone call was going on, it was PowerPoint by death. And it was one of those really, really hard conversations where everybody was talking at us and not talking to us. And 15 minutes toward the end of the call, I blew up. I blew a gasket. I said, if you were serious about involving patients, you call it Partnership with Patients. You would have had us to meetings before now. And honestly, you should grab the domain name right now for Partnership with Patients. You should get a Facebook group going, and you should really meet us at our own level. And there should be a conference. There should be a conference with us there. So within 30 minutes, I and the other patients on the call started building the website, building a Facebook group, and designing our own conference that we would invite CMS to. So we crowdfunded that on MedStarter and Health Tech Hatch. So this is one of the major things about social media. have a great social media profile, and you can crowdfund amazing things. So we funded the creation of a conference in about 2 months. We funded the travel for the patients to get there. Did all this on social media platforms, and CMS did attend. It was in Kansas City, and it was an amazing, amazing moment, and everybody had buy-in because everybody was part of it. We built it ourselves. And then, in 2012, I got very concerned about hospice cards, because one of the major problems with end-of-life conversations in this country is we don't actually have them. And I thought one of the ways we could have them is if you went to the Hallmark store and on those little headers that say birthday and anniversary and sympathy, there was also end of life. There was also a hospice cards. So we started a tweet chat. We were actually on a tweet chat with Ted Med, and I started throwing out this idea, and then Hallmark starts commenting back to us within this tweet chat, which was spectacular. And they told us that, there was something we could do. We could go to the Gold Crown store site, and we could find an appropriate card. So I typed in end of life, and it came up with bat mitzvah cards. And hospice was a term not found. So one of the things that came out of this struggle was them deciding to change their search dynamic within Hallmark itself to recognize end of life as a category. But also it got picked up by a lot of news agents throughout the country about, hey, wouldn't this actually be a great idea? And then Greeting Card Universe contacted me and said, we love your idea. And we have staff who've had family members die. So we're going to make 24 hospice cards. We're going to make them part of our line so other people will have this opportunity to talk at the end of life. And that's what a social media shout out can do. The walk-in gallery. Okay, I don't know if you guys have ever heard the term flash mob. Flash mob, super cool. A group of people coordinated by email and social media to meet at some predetermined action or a particular place and time and then disperse quickly. A walk-in gallery. So what if all these jackets just started showing up at medical conferences and people started spreading the word that patient stories were just as important as data, that you could link them together and we could change the world? I love what Shepard Fairey has to say. The more stickers that are out there, the more important it seems. The more important it seems, the more people want to know what it is, the more they ask each other. It gains real power from perceived power. You can change the world. And so that spread. And we got traditional media outlets talking about what the walk-in gallery was. We even got a marketplace. I said, okay, wait a second to the marketplace people. I'm like, you do know the walk-in gallery makes no money. That's part of it. It's a movement. We don't actually get paid. And they're like, yes, we understand, but sometimes a thought or a concept is more important than business itself. And so, all of a sudden, more people started painting. Like if you see one of those individuals there, that's Lygia with ONC, painting at a Health 2.0 conference. There are amazing people out here in this space in healthcare that have multiple talents. Maybe they make teddy bears for people who are sick. Maybe they paint and never let anybody in the world know. Maybe they can sing amazing rap songs about health IT. We need them speaking, because guess who we got to get to? The people outside of this room. So then we decided to create a site called speakerlink.org. It is free and open to the public. Anybody can list themselves as wanting to speak about healthcare, and it speaks from that patient center, and it gives us a platform to spread our word. So, my question for you today. I know social media is scary. I know a lot of the stuff I'm talking about is really, truly terrifying, but will you jump? Will you join us? Tell your story and rock the world. Thank you.
Good morning. Well, nobody should follow Regina. I think it's really good that I'm talking about sex this morning. So I'm Larry, and I lead the Bedsider program. It's a birth control support network at the National Campaign to Prevent Teen and Unplanned Pregnancy. And you can find Bedsider at bedsider.org. Let's see. There we go. All my remarks today are in the context of Bedsider, and the focus is social media. Social media is really hard to measure. And I'm ready to reject actually the question of how do you measure it, because you can when you see it, it doesn't mean that it's actually working, and if you can't see it working, it actually doesn't mean that it's not. It may be that, like this second bullet says, this customer journey, it may be that you're touching somebody along their journey in a place that's invisible to you, but really, really important. And in the end, it moves them to have the behavior you're actually seeking. And you have to find your own value in the measurement that has meaning to your work. And don't stop too long at that measurement question. Keep moving forward. And I love Peter Block, and this is just a paraphrase of one of his great books. Don't let the how get in the way of the yes. Don't stop too long to think about whether it's working. Just keep working at it. Just keep putting things out there. Keep connecting with your audience. And work hardest in defining your goals and making sure that what you're doing is connecting, what you're doing in social media is connecting with those goals. So Bedsider's challenge and its overall goal is to reduce the proportion of unplanned pregnancy by 20% by 2020. Currently, 7 in 10 pregnancies among single women, 18 to 29 in the US, are unplanned. It's a really big number, 7 in 10. And among those having sex and not trying to get pregnant, 19% are not using contraception, 24% use it inconsistently, and among those who feel it's very important to avoid an unplanned pregnancy at this moment in their lives, 34% say it's likely that they'll have unprotected sex in the near future. And what we find is that when people say that, that's what happens. So the nature of the challenge for us, because unplanned pregnancy is so complicated, and there are so many triggers and places along the way that it can go wrong, it's an ongoing challenge. And I know Susanna's a fan of BJ Fogg, Susanna Fox, BJ Fogg, and he would say he would call it an ongoing behavior challenge, behavior change. It doesn't happen just once. It's not like organ donation, let's say, which not here to say that that's easy either, but if you get somebody to agree to organ donation, it's one time. But if you're a woman taking the birth control pill, it happens many times. Or even if you make the decision to get an IUD or an implant, that's a one-time decision, but you still have side effects to face and other decisions in your life that can get in the way. So social media is really, really good match for an ongoing behavior, because it offers, as BJ would say, the motivation, the information, and the triggers over time to address all of those ongoing behaviors. So the Bedsider vision is this, and we started looking in 2008 at the reasons people weren't getting their birth control right. And we learned that drinking and good times and side effects and the misperception that long-acting methods were not appropriate outside of long-term relationships were all working against birth control. And to combat that, birth control, we thought, needed rebranding. And this is, humor, inspiration, entertainment, excitement are all part of the Bedsider experience. And we try to make our content engaging, social, and shareable. We have a rewards program. We offer prizes and try to get people talking about their issues and their own barriers in our social media channel. This is the view of the homepage, and it's something that we think doesn't look like anything that's out there. And it's all about making birth control easy, anytime, anywhere. By the numbers, nearly 15 million women in the United States are there are nearly 15 million women in the United States between 18 and 29 who are single. And that's our target audience. Since the launch of Bedsider a little over 2 years ago, we've had about 4 million visits. And we think of those visits in this way, in a kind of a funnel, where we have a number of impressions, we have TV commercials, we have web banners, we have social media, and that leads to a certain amount of engagement, video views, likes and follows on our social media, and that leads to some acquisitions. And acquisitions we define as somebody who chooses to have ongoing contact with us. Because as I've mentioned, that ongoing contact is really important for us to help them, stick with them as they try to stick with their birth control. And this funnel helps us determine our return on investment. So if we just get a certain amount of impressions, it should lead ultimately to a certain amount of engagements. It helps us learn how to spend our money. So speaking of spending money, we started something about a little over a year ago, and that is Twitter promoted advertisement. And I would tell you it's worth every penny. This is one of the benefits of a promoted account in Twitter is this analytics view that you get. And I'm going to point out a couple of moments in time here. The first arrow on the left is when we started doing promoted tweets, and the second arrow is when we hired somebody on staff whose job it was pretty much full-time to pay attention to our social media. And you can see there are upticks in both of those moments. And at the very end, I didn't have an arrow for this, there's another steep incline you might notice. That's when we started to do promoted tweets on mobile. Mobile in the last couple of months has gone over the 50% mark for us. So more than 50% of the people visiting Bedsider are visiting on a mobile phone. And because we're now trying to we're successful in attracting them on Twitter, you see that last jump there at the end. But what I'm really happy about here is that they're the right people. You know, you should ask yourself, well, who's interacting? What are the demographics? Is the gender right? Well, there are more females than males. That's what we like. When we started this program, if you look on the right about who your followers also follow, when we started, it was all public health accounts, and that's fine. But it meant to us that we weren't really getting out of the box, that we weren't getting to the people we really wanted to get to. And now that's changed. The people who follow us follow Katy Perry and Ellen, you know, and that's what we're looking for. We really are trying to figure out, well, can we talk about birth control in other contexts besides public health, like comedy on the left and reality TV? Well, it turns out that we can, and with 16 and Pregnant being such a big hit, it's probably no surprise. So here in this dashboard, we're seeing the effects. So how do we actually do it? Sometimes when we use social media, we're looking for engagement. Bringing a smile to somebody's face, as Regina was just saying, is really important. And that might be all we're trying to achieve. And when we're trying to achieve that, we're not looking for clicks back to the website. So when we look at the analytics on this one, you can see that there aren't a lot of clicks, but there are a lot of likes and a lot of people reached and a lot of smiles. Smiles are really important and not often before Bedsider would say associated with birth control. We found out that when people talked about birth control, pretty much saying, oh, it sucks. Well, yeah, and so that's what we're trying to do. We're trying to change that association, make it be more positive, give people the confidence that they can achieve their own goals. Here's another one. We really did want people to come back to the website here. We also wanted people to smile, which they did, but we got a lot more clicks. And the clicks led to people signing up to our Frisky Friday newsletter, where they can get some of this material. Here's a slide. I thought about cutting this slide, but I thought it was important to note for all of you that as we look at the distribution of our reach across the week, it's all 7 days are important. And the highest points are after business hours. So we definitely have to have our social media manager planning tweets and Facebook posts that go out after she's gone home. Sometimes she's gone home and still does that, but she uses the scheduling functionality to great effect. And here is a report from Google Analytics to show you who's coming to Bedsider from those social media accounts. Susanna talked about a lot of these social media channels. You can see for us, actually Twitter's a little bit more important. For us, the demographics are a better mix on Twitter than they are on Facebook. And Facebook tends to be a little bit like your family album. It's a little harder to talk about birth control on Facebook. So it's a little bit less of a driver, but an important driver, as you see. Tumblr is also very important for us. But once again, I would emphasize that we aren't only measuring our success and our work through who comes to Bedsider. But ultimately, what we're looking for is engagement, quality engagements. Do we have a unique engaged audience? Are they amplifying what we're doing? And is there a consistent activation? So this is an example of amplification when our new ads came out about a month ago on BET. Somebody took note of that. Here's another one that I think is the Holy Grail. They, on their own, tweeted this out. And I think that that comes from all those smiles that we put out there in advance. And if you haven't seen our birth control reminder messages, you would know why she's so concerned about losing her phone. That this is a pill user who gets a message from us every day, and it doesn't say just take your pill. It says it gives you an interesting fact or how to say I love you in Icelandic. And that keeps her attention. It's not a boring reminder. It's motivation and a reminder at the same time. And this was just something, sorry that's so small, but this just came in. This is the response to a promoted tweet. So if you think your promotions are boring or need to be boring, you're wrong. They should be in your same voice. They work best when they are in your same voice. And actually, our promoted tweet went out, that's the one at the top, that said, warming the feet can increase your chance of orgasm by 30%. Go out and buy socks. And that people down there, people in the feed said, well, this is the first promoted tweet I've ever retweeted. That's great. That is really great. And that further down somebody said that Bedsider won the internet. It doesn't get much better than that. So I'm just here to say thank you for having me, and that if you're going to do social media, just make sure that it is in line with your goals and spend a lot of time up front figuring out what those goals are, and adhere to your voice. And don't let anybody move you off your voice, because it's really the most important thing. It makes you authentic, just like Regina. Thanks a lot.
So, we've got some questions. Okay. Thank you. So this is for Regina. Regina, you're my hero. Surprise. What use is patient data without patient stories?
You know, for many, many years, it seemed that was all there was to patient data. You know, this term had de-identified. It's a very popular term. You know, the idea that just wipe people and their reality and their life off the actual clinical data. And all we need is the clinical data. And we're starting to realize through amazing tools like social media and even through data sets that that's so wrong. You have to couple the story with the clinical facts, and that's the way we used to have medicine in this country. But somehow over the years it got pulled away, and we have to change that. And we are changing that by what we're doing right now.
So for Susanna, do you provide any training or education for nonprofits that want to use social media more at Pew?
No, so the Pew Research Center, we're in charge of collecting the data that hopefully will drive the conversation forward, but we don't provide training about it. The resource that I look to most often is actually AIDS.gov. They have a fantastic new media page that goes over all of their techniques, and they do essentially online training for healthcare entities who want to get into social media. So that would be my recommendation.
That's fantastic.
AIDS.gov, AIDS.gov.
We're going to put all the presentations on our website. We'll go ahead and add that resource to that.
You know, I would just add that a good Google search will turn up a lot of good stuff too. The Ad Council, for example, does at least quarterly webinars on topics like this, social media and other topics related to what they do. And it's not specifically healthcare, but it is all oriented towards, making the world a better place through media of some sort.
And there are individuals that this is their job. So like I know Reed Smith in Texas, he specifically just works on that group. Organizations, nonprofits, and hospitals who want to learn social media. So there are people that this is what they do, is they teach you and get you through the process.
I think also when you do a search, and this applies to just about everything, you'll find that the usual suspects for whatever you're interested in keep cropping up. People will link to them, they'll mention to them, and that's one way of sort of gauging credibility and determining sort of what's a good resource for you. You'll keep stumbling across the same thing. So this is actually a question for everybody here. Maybe Larry, we'll start with you. So how can smaller organizations, and I think a lot of folks in the audience maybe come from that, have an efficient strategy around social media? There's a lot to choose from. There's a lot of platforms. Okay, there's Twitter and there's Facebook and Instagram and Tumblr, and what is this and what is that? And when you're trying to get started, there is a lot of that noise, and I think also there's a lot of unclarity about what is my first step. From what would you say? You ended your presentation with a little bit of advice about getting started with social media, but maybe you can expand a little bit more.
My team was just 2 people when we started. We're 5 now, so we're not a huge team. I would say do one thing really well. Pick one channel and learn how your voice is pushed out through that channel. And if you could do that really well, then you can we learned how to take that same kind of voice and adjust it for other channels. And it becomes easier because a tweet can become a longer Facebook post if that's appropriate, or something on Tumblr. Regina talked about the value of pictures. I can't underscore that enough, that pictures are so important. So if you were to start in one place, it might be with good pictures right now. And that gets you into a lot of different channels. So I have a mantra at work is create once and produce everywhere. Yeah. So if you create one photograph, that goes into Instagram, it goes into Twitter, it goes into Facebook, it goes into Tumblr, and you should put it in all those places, because what we find is that we actually have different audiences in those places, and the people who see it more than once are okay with that.
Do you refine your message? So do you change the message that you put on Facebook with that photograph, tweak it when you tweet it, let's say, or put it on Instagram? Do you change it, or do you have the same?
We change it.
We
just slightly.
Yeah.
On Instagram, for example, you can't use a link.
Right.
So that's really important to think about that. And you stay in the stream, and you may have to use hashtags more creatively in Instagram, for example.
So we're going to move. Regina, I'd like to get your
Sure.
perspective on this.
Segueing from his conversation, another really important tool that I don't think any of us mentioned yet was Flickr. So when you post on Flickr, you can post your stuff Creative Commons, right? So it can get used by other people. This is a really big deal, because when I attended one of those small CMS meetings with the Partnership for Patients team, which thank God they now invite patients to every one of those internal meetings. Yes, I talked to them about Flickr because they have really ridiculously boring PowerPoints. And they said it was because of, guidelines and 504, and I was like, no, you have to explain the picture if you're going to put it in, and make sure a person who's blind can understand what the picture is. But that doesn't stop you from using a picture. And then there's budgetary concerns. I'm like, Flickr Creative Commons. It rocks. You can get a ton of pictures as long as you're not selling those pictures. You just attribute them to whoever they came from, and you can use it. And that's one way your message will spread, is by putting it out there with that kind of information. The other thing I wanted to go back to the beginning of the question was a small organization. I am an organization of 1, so I totally get the not having the bandwidth to do a lot of stuff. So one of the things that can be really powerful is, yes, pick your media that you really excel at. I find in the world of health activism, that is Twitter, okay? Because on Twitter, people act. So putting most of your energy into Twitter makes a lot of sense. Leave some energy for LinkedIn and the other platforms, but Twitter is your go team. Now, if you have a major campaign, there's this thing called an intern. I highly recommend you hire one, okay? You will help them out, and they will help you out. Because when you're doing a campaign, it's just so much keyboarding that really having a person side by side who can help you out, even if it's only a few hours a day, will save you. And every major crowdfund I've ever done, I've hired an intern to help me with all of the tweets we're going to have to send out. And it's thousands, okay? So that's a really great key.
Could I add something really quick? Sure. Because I love what you said about Flickr. I think something that's been really, really important for us is a philosophy of sharing. Mm-hmm. And we hardly create one thing that we're not willing to give to everybody else. And that it is really important in healthcare and the reproductive health area, because there was at least, and I think still is, a dearth of visual information that people can use. You know, just simple things like really high quality pictures of every method of birth control. Or, you know, a picture of a pharmacist handing a pill pack to somebody. These kinds of things that really can help others tell the story, well, we just give them away. And that has brought in, one little nonprofit in Washington, D.C. is not going to solve a nationwide problem with unplanned pregnancy. We need partners. And this is a way to help us get partners.
So before we move to Susanna, just a quick reminder that we do have mics at the front of the room. They're on the left and on the right. So please feel free to come up with your questions. And Susanna, how would you respond to that previous question?
So the Pew Research Center is a large organization, but we started small in terms of social media. And I actually confess that I joined social media before I was supposed to. And I highly recommend that. Don't ask permission, start, apologize later. You probably won't even have to apologize. You'll probably have people quietly knocking on your door and asking for help, which is what happened to me, because I was a researcher who started blogging and using Twitter to get the word out about our research. And if you're an organization where it's important to get into the press, that's actually a big part of my job, and then Twitter is a wonderful way to do that. There are lots of reporters on Twitter who are looking for story ideas, and if you can start identifying whether they're local or national reporters and following them and understanding what kind of stories they write and what kind of stories they're interested in, they'll sometimes actually tweet out a message saying, I'm doing a story on this topic. Does anybody have any tips for me? That's when you strike and say, yes, I have a story for you, or yes, I have data for you. And that's a way that you're part of the conversation, and it's collegial, which I think is the biggest thing that I would say about Twitter, that it's a community of colleagues and a community of friends. That's what I've found.
Thank you for that. Does anybody have any questions? Okay. Would you step up to the mic, please?
Hi, I'm Carolyn. I'm a Master's of Public Policy student and year-long intern. Actually, thanks for the shout-out to interns at Consumers Union here in DC. And this is a question mainly for Regina, but for anybody. I was just curious about when kind of exploring what you're going to do with your bandwidth and what you're going to focus on. How do you choose your issues? How do you kind of pick, you know, bedside tray tables or hospice cards? How do you kind of hone in and focus on what you think is important to address?
That would assume that I focus, but I have ADHD. You know, so one of the things about being an artist and any person who has muse, right, is sometimes things speak to your soul. Like some things, it clicks and you're like, oh, that is what I'm supposed to be doing now, right? And when that happens, oh my goodness, this giant campaign just flows out of it and it's saying yes to that insight and that spirit that's within you, right? That does mean you're gonna make some other people angry, right? So I have 38 jackets I need to paint at home, but I'm here at Families USA, you know, because that's what I need to do right now. The one thing is you're going to have to tell some people your part's going to have to wait a little bit while I focus on this part right now and figure out what is it that you feel speaking to you. I think that as human beings, we have let go of a lot of our insight and our just understanding of the spirit, and that there's moments in a life where something's deeper going on. And you will meet people and you're going to connect with them in a way that is so wonderful and is so deep, and it's in person, but it's also on Twitter or Facebook, right? And when you see that moment happen in your life, say yes to it, not no.
Thanks.
Could I just follow up and say that is, I heard Susanna saying the same thing at the end of your last bit where you were talking about community. And I think that one of the hardest things to learn on Twitter or any social media platform is how to be yourself. You know, so too often I see updates on Twitter from organizations that are just, you know, something I could see in a press release. And it's much more important for it to be real. You know, I'd much rather understand the personality of the person who works at the organization on Twitter than the organization's point of view on something. Maybe there's a place for all that to be mixed in, but I think personality is so important.
Yeah.
So just a follow-up question, and this is for all of you guys. I think probably what you see here is a breadth of experience and probably of need when we talk about social and digital strategy. So some of the folks in the audience are just starting out, some have more fleshed out, you know, media and social media campaigns. In terms of sort of finding your voice, and it goes back to the question of, well, how do you choose what to talk about? Sometimes it's from the gut. It's that passion and the soul and the thing you need to say. Sometimes maybe it's a little more thought out. It might be part of a broader communication strategy, et cetera. When you have a lot of policy issues or advocacy issues that you want to put out there, when it comes to social media, does social media change the way that you prioritize those issues? So, you know, back in the day, you might have issued press releases and you're pushing out reports. Today in social media, the conversations change a lot more quickly. And, you know, that long tail priority today is very different. You have to react to things more quickly. So how does social media change, and maybe I'll start with you, Susanna, kind of empower you to be a little more nimble? I'm assuming it empowers you to be more nimble, but how does that change your perspective when you want to push out your message and you make those choices?
So I can tell the story of how the Pew Research Center has changed over the last decade, and that is probably in the 90s and the beginning of the 2000s, I would imagine the Pew Research Center as a beautiful ivory tower with one door. And every once in a while, probably every week or so, the door would open and we would hand out a sheaf of papers. It would probably be a PDF, and it would be a really important report based on a lot of research and a lot of thoughtful analysis. And we would hand it to the New York Times and the Washington Post and the LA Times and maybe a few other outlets. And maybe we would put it up on a website as a PDF in case citizens wanted to look at it. Over the last decade, different people have started punching holes in the ivory tower and letting people look in at our process, and we've started looking out at the people. And now I think about the Pew Research Center, the work that we do, as a mirror and a window. And we are a mirror for society where we're trying to reflect with survey data what is actually going on all across the world so that people can see themselves clearly. But it's also a window into maybe people's lives that aren't yours. The Pew Research Center, as an organization, maintains a formal tone on social media. It's, you know, we're known as a fact tank, not a think tank. And the advantage is that we have pretty unassailable data. And we spend a lot of money, thanks to the Pew Charitable Trust, gathering that data. And we're very serious about the numbers. And luckily, people love to share numbers. And so instead of handing out a 25-page PDF, we will open a window and send out one data point. And that data point will get shared, frankly, farther than any of the reports will go, because that one single data point could turn out to make a real difference in decision making at policy levels across the world, in public conversations, kitchen table conversations. And so in that way, we maintain a rather formal tone and a seriousness about our work that I think can be reflected in a lot of people's work. But then individual researchers can also show a little bit more personality and show, frankly, a little bit of heart. And I'm continually surprised that the more we open up about our process and the more we're able to allow people to look in at our process, the better it is.
Another thing that's really important is a traditional organization, to some extent like Pew, is somewhat limited in how fast they can respond to an event. So we recently had the major social media storm of what was going on with Lisa Adams. Okay, so I assume a lot of you were following that conversation with the articles that were written about her in her desire to share socially what was going on with her cancer. And it was a kind of cancer that's pretty progressed, right? So there was a feeling that maybe that was TMI, too much information to talk about breast cancer when it's further along than, I fought the great fight, I'm all in pink and everything's all better now, okay? Because it's getting close to the end of life conversation, which we don't want to talk very much about in this world, right? Or the prolonging of disease. So there was some negativity within the traditional press. Well, there was a social media storm that came, okay? All these folks in the world of social media just whoosh, like a fire, defending her, defending the fact that we would like to talk and we would like to share, and what we think is too much information may be very, very different than what you think from a traditional worldview. So that's one of the beautiful things about being a blogger and being a social media voice is often you can defend someone you believe in really rapidly, and that changes the story. That got an article pulled, okay? So that's powerful, and it just happened to me last week with a friend. I mean, put in a negative position, in a legal negative position where he couldn't actually say anything in defense of himself, I could defend him, right? And that's your power, the ability to speak when others cannot. So that would be part of the strategy.
I would just add maybe one example. In November, this past November was the first time that we designated a day to say thank you to birth control. It had never happened before. So in the past, before social media, we may have sent out a press release and had an event in a room like one of these. But this year, it was moved by social media. We asked people on social media to say thank you for anything they wanted to say thank you for. And that's a really important part, is that there's a 99% of the women in this country use birth control, but it's a silent majority. We wanted to give voice to all of those women and men who benefit from birth control. They finish their careers, they have healthy families, they have 2 kids instead of 10, whatever, and say thank you. And that, we use actually a service on Twitter called Thunderclap for the first time, which actually worked for us really well. What happened is people signed up, and at one moment in time, all their tweets went out at the same time. Actually, one of our tweets went out at the same time through their accounts. We did it small with 100 people, but it was really powerful. And we heard people tweet back, is something going on about birth control today? And that was a really nice sign of success. So very different way of getting the word out with social media.
Does anybody want to come forward? Yeah, please come.
Mark Haney from the Metro New York Healthcare for All campaign. I have 2 questions. One is regarding this issue of data points and use of infographics that really seems to be becoming more prominent and powerful on social media. The other question is about integrating use of social media with mainstream traditional organizing and advocacy efforts, because I don't see it as one or the other, it's really both. And for those of us who have limited bandwidth, as you've discussed, sort of figuring out what that balance is.
Great. So I have a follow-up question for you, if you don't mind. Are you in favor of the movement towards more infographics? What do you see that you like or don't like about using more infographics in social media?
Well, my experience of it through social media that I use, which is limited, not as comprehensive as you folks have described your own lives, is that when the graphic is right and the data is right, it really makes a point quickly to audiences that don't follow a particular issue 24/7, like those of us here in this room follow healthcare, for example.
Yeah, and that's a great point, and it goes toward what Regina talks about in terms of using a photo that appears on Flickr or using a piece of artwork to catch the eye. And I'll confess, I'm not a visual person. I'm a data person. And so I'll put together a line chart or a bar graph, and I'm so happy that Twitter now makes it easy to share that, and that people love that sort of thing on Tumblr and on Facebook, that it's a visualization of data, because there are so many people who will only really understand it if they see it visually. Now, I think it can go too far. I've seen some infographics that are 2 screens, and that, to me, I can't scan that. And so for me, I want something short and easy to scan and easy to share, not, for me, a poster.
And also it's, I mean, infographics they rock. For a whole bunch of us who are mathematically challenged, they give us the visual basis so we can understand what in the world that wonderful data person was trying to tell us. But also, thinking of new ways you can do infographics. One of the major things that I do with the walking gallery that really intrigues people and excites them is we have a map of the United States done in Lego with Lego people representing the entire walking gallery. And it's put out in any one of our gatherings, and people get this strong visual of, wow, there's that many of us, and they live all these places. And it's a type of infograph, but it's not in the way you would normally think of them. So one of the ways to get your stuff shared is using those tools and changing it in such a way that it spreads much more rapidly. So for instance, one of those pictures got to be the header for Kaiser Health News for like a whole week on Facebook, because it was just a visual that was so strong.
I would just say anytime you have an opportunity to represent something visually, do it. Even if it's appropriate for your voice and you can take a piece of paper and sketch it and take a picture of it, you should do that. It's really powerful. And I think, if I understood the second part of your question, there are a lot of moments in the workday where your output can be repurposed for social media. So think about the emails that you write to somebody where you're reporting something. A lot of that ends good tweet material. And so I think getting yourself in the habit of, well, what am I already doing that people would want to know about if I just tweaked it a little bit, is really, really important.
And to add on what he just said, getting people converted to Twitter over email will save your life, because emails are too verbose, right? So if you get people converted to where they only speak to you in 140 characters, you just opened up hours of your day. So just listen.
And to add a little bit to that about organizations with a limited bandwidth, as you put it, I think it's good to remember that you may not already be engaging in social media as much as you are, but I think we are sort of natural thinkers in terms of how we can exploit social media. When you write a press release, when you send an email, you're thinking about a headline already. What is the subject line of your email? You start a conversation, what's your first sentence? Or what's the point of this meeting? Or what's the point of this coalition that we're bringing together? And I think I would describe social media as those highlights, those headlines. You tell your story in a headline. When you write back in the olden days when we were writing long research reports or whatever, we still had, today we call it chunking out the content, but you were still telling your story in fits and starts and bits and pieces and threading it together in a narrative. Well, social media now lets you sort of roll that out in a more dynamic way. You can tell your story by those headlines, and you can tie that narrative together. And what's really cool is you can tell that story differently across all these different channels. In one way, you tell it through pictures. You take that content that you have, and you pick out the data points that might be the most interesting, and you maybe push those data points out through Twitter. So I think actually social media is great. It's not just one more thing you have to do in addition to all the other things you had to do before. It's a smarter way, if you're able to use it well, of actually taking advantage of the work that you've already done. And this might allow us to segue a little bit to the next question. I think another advantage of social media and the tools we have today is that it actually allows us to engage in a conversation about analytics and metrics, to measure, when we choose to measure, how well we're having those conversations, and are people doing what we'd like them to do. So this is a question to everybody here. Maybe Larry, we'll start with you. Can you talk a little bit about the metrics and the data that are most important to track, maybe for groups that are either just starting out or they've been around but they just don't have a lot of resources? So in other words, again, the capacity is on the lower side. How would you get that started, or what would you recommend?
Well, I think at the risk of repeating myself, it really goes back to what you're trying to achieve. If it may not all come back to likes or follows or even click-throughs, it may be that it's about sharing. So let's say you just really want to get an idea amplified. That might be the most important thing, and by the right people. So I think that knowing your audience and knowing how to understand whether the audience you really want to be involved are involved is really important. So I would favor a smaller audience of the right people than a larger audience of anybody's. So I think it's just really knowing what your goals are and applying them to social media. It's not the greatest answer in the world, but it really goes back to what you set as your program goals.
I'd like to throw out there a couple of things that you might not be aware of. One is Simpler. Simpler is this amazing project. Is the hashtag on Simpler? Does anybody know?
Don't know.
Okay, so basically what Simpler is doing is the healthcare hashtag project, and it is amazing, and you need to know about it. So most conferences will register their hashtag with Simpler, and Simpler will do the analytics for this conference for free. So they'll archive all your tweets so you can get to them. It will take all that information to show, when it was doing well, who was tweeting, what are the top 10 by mention, what are the top 10 by tweets. It's an amazing tool, and they don't charge you for that. Why they're doing that, though, is they're creating a massive data aggregation of what's going on in healthcare. And if you can see these patterns and what the interests are, you can do spectacular stuff with that. So it's this wonderful give and take. So that's, as an organization, as a hashtag, you should be doing that. The other thing that a lot of people know about as individuals is clout, which can give you some kind of idea of the person's exposure within social media. What kind of clout score they shows to some extent that they have a voice, right? Between those two tools, those are free analytic devices for you. So you can go to your person in charge of the money at your organization and say, look, this is what we did with this conference just on a hashtag. And oftentimes when they can see spread, they're just floored. Like one of the best examples I have of that is HIMSS, which is a big conference that happens in health informatics. There's usually 39,000 people who attend that event. So it's a big conference. And when I attended it these last 2 years, because of the walking gallery, we had 25 members of the walking gallery in attendance in the 39,000 people that were there. But because they were there, we were in the top 10 by mention in 39,000 people. Okay, that's really good. So, so it's one of those things. Use the analytic tools that are out there that are free of charge.
Anything to add?
No, I'd love to hear the question.
Sir?
My name's Richard. I'm a volunteer and a board member with Tennessee Healthcare Campaign. My question is this. I'm obviously of a generation that's not so adept at this process. And so that may be why I have the question. It may be an obvious answer, but in efforts that I've made and other organizations have made to use social media to spread a message, and I guess I'm thinking particularly Medicaid expansion, we end up just talking to ourselves mostly. Or we're talking to the opponents and they're making their appropriate comments back to us. And I'm wondering how we get out of that envelope and start reaching people that we wouldn't ordinarily be reaching.
Larry has to talk to that, yeah.
Yeah, well, I think we had that exact experience on Twitter, at least, where we were talking to our friends at Planned Parenthood all the time. And that's great, we love them, but we weren't reaching our audience. And so I don't think that there's a magic sauce, except to say that we started following people who are not the usual subjects on Twitter. So a lot of people like to follow you back. So following them and saying through that follow that you're interested in what they have to say is really important. And following up the follow with some kind of interaction is also important. So start to just gain experience interacting with people who are not the usual suspects and not the ones who are most likely to comment, I think is the first thing. And then for us, I would say the promotion, the little bit of promotion that we do has helped get us out of the box, because when you do that promotion on Twitter, you can say, put this tweet in front of people who follow people like that. So instead of saying, put this tweet in front of people who follow Planned Parenthood, I would say, put this tweet in front of people who follow Katy Perry. And we get that audience, and it's really worked for us.
To add on to what Larry's saying, that one thing to remember as an organization, oftentimes you have an organizational voice or handle. That's your organization. Oftentimes that is somewhat crippled in what it can say. It can say some funny things, but it is an organization representing a concept and not a specific person. One of the things that really can rock your social media strategy is when all of your staff become part of social media.
Yeah.
So Sally from your organization is Sally, so-and-so on Twitter, and they happen to work for blah, 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 right? But these tweets are my own, not my organization's. But still psychologically, I think of Sally in conjunction with her organization. And Sally's great, and I love her. And now in my head, I love her organization to some extent. So this is a team player activity. If you love your organization, your hospital, your campaign, then you should be talking about that in your regular life with your friends on Facebook, your friends on Twitter, your friends that are throughout all of social media. And that's one of the things that's happening right now is all of this is blurring. Our professional and business lives have blurred together. And that allows you to excel in this world.
And I want to say that although the Pew Research Center collects data that indeed shows that older adults are less likely to be online, less likely to have smartphones, less likely to be using social media, your mileage may vary. I introduced my grandmother at age 85 to the web, and she leaned forward intently as I showed her the web. This was back in 1995. And after a few minutes, she slumped back, and I thought that maybe I wasn't explaining it very well. And she, in fact, said, I was born too soon. Because she immediately grasped what the internet was going to be. And that day, I signed her up for AOL. And she was a daily internet user until she passed away 10 years later. And she was not born too soon. She ruled her online communities for the clubs that she was part of. And for me, it was because she was the same person online that she was offline. She was an expert in what she was interested in, and she brought that online. And that's the same exact thing that social media is good for.
Thank you.
Hey, Carla, could I go back one question? I wanted
Sure.
to just to
And
the
I want to
measurement.
encourage, we've got about 10 minutes, so I just want to encourage anyone. Okay, we've got some folks up on. But
Just to
please.
measurement for a second
Yes.
is, I just finished writing a grant report for my funders. And well, I do mention the numbers and use the tools that we can use, to report on the numbers. But what matters most are the anecdotes. So, and what drives their interest in the program I run most is that tweet about I lost my phone and I was sorry that I was afraid I'd miss my bedsider reminder. Pardon me. So I think it's really important, in addition to the numbers and those tools, which are critical, that you also spend time looking for those really important nuggets of information that tell your story.
Fantastic. Thank you. Yes?
Hi, I'm Amy Lynn Smith, and I'm a freelance writer and strategist, and I am always looking for new ideas of how to address and respond to people who will disagree with you, and as we know on Twitter, they'll be pretty vehement about it, especially if you're talking about things like birth control or end of life or healthcare reform. So I welcome any good suggestions on doing it in a positive, productive way.
Okay, the haters. Yeah. Okay, there are trolls on the internet. There are people who, okay, there are people that are so negative and so evil to you, you will have to block them on every platform, everywhere. That's just the way it is, because some people cannot be reached, okay? Other people, they often can. I've actually found people that have written negative comments on my blog anonymously, but gave enough hints that I found them. And then started talking to them, and some of them are even my Facebook friends now. You know, so if you can get people to realize you're real, right? That's part of the key of all this, is talking about the real you. I mean, anybody who follows me on Facebook learns very quickly I have a son named Freddie and I have a son named Isaac, and they see the most bizarre, cool things. And we're right now going to have a Doctor Who Back to the Future Space and Time birthday party tomorrow, and I've been building a TARDIS in my basement. And they learn all this real stuff about me. And that makes me not so evil, okay? That I support health reform and patients' rights. You know? So I also do friend people that are very negative to this space oftentimes, because we have to talk with people who don't agree with us. That is one of the dangers of social media. You can create an entire enclave of people who think just like you. And that's really dangerous if we're going to move the movement forward. You also will do different things on different platforms, like we talked about Facebook. Facebook is friends and family, okay? Oftentimes we don't talk about birth control in our status lines on Facebook. You know, I'll have all my aunts in Oklahoma talking to me. So we tend to change our language. On Twitter, though, Twitter is one of those ones you can just talk about anything. You might have someone who goes after you. I did have someone who went after me during the hospice cards campaign. I did my best to just try to be reasonable, intelligent, not get into a flame war, think before you tweet, you know? Yeah.
What I would add also, what I've seen used really effectively, and Regina, you've used this, and if you don't know about what happened with Lisa Adams, this was very much a part of the story where she was essentially attacked in print by two columnists, one in The Guardian and one in the New York Times, for being open about her life. Well, she could call in reinforcements on social media very easily, and that's what you need to do. So in your replies, just put a dot before your reply, and that lets all your followers know that you're replying to someone who disagrees with you, who maybe is being unpleasant to you, and your friends will come over and see what's going on, and it's a way to be visible and to open up the conversation to more people. And indeed, you know, and something I really admired about how Lisa handled it, some of her followers got pretty vitriolic. Lisa herself always took the high road, and you can never go wrong if you take the high road. Any more? Does anyone? No? Come on up.
Anthony Wright from Health Access California. Appreciate the discussion, especially around organizing and reaching out to all news constituencies. Many of here are organizers, many of us here are policy advocates, and so the question is, what is any strategies, platforms, ideas about things directed at policy makers, since that is what we're trying to specifically influence? You know, what is the online equivalent of being in front of the hospital painting the art when the board of directors shows up?
Well, you blog about that, you know. So it's one of those things that thinking of outside of the box ways to change health policy. I mean, you want to make sure whatever you do, you want it retweeted. You want people talking about it. So often thinking of something a little bit edgy, getting people on your team that maybe are artists and musicians and outside the box thinkers might be really helpful to you, because that which is done in real life can then be sent into the world of social media and can be really, really powerful there. See, I'm a health activist, but my focus is health policy. So everything I'm doing is to change health policy to make it more patient-centered. And that is weird for folks, but they're coming around to the idea that you actually can paint and change health policy. So think about a diverse new members that you can bring onto your team that you may have never thought before, and use the stuff that they do.
I think also, just to quickly interject, you know, most public policy folks are on Twitter. I would choose Twitter maybe a little more on than perhaps Facebook, although you know, your demographics probably bear that out. And I think in that sense, Twitter is almost it's almost like a mainstream conventional channel of getting your public policy message across. You can decide that you want and should decide probably that your angle, your hook is going to be a little different. Maybe you draw them in with data, maybe you draw them in with an interesting graphic. It doesn't, you know, you can have and adjust the level of seriousness and levity, your brand, your voice on social media. I think, you know, when we first started hearing about social media, it might have been perhaps slightly miscast as something that was light. It was superficial, it wasn't meant for substance, and I think just because now everybody is on social media, it is a more accurate reflection of the world, including public policy experts, and you know, I think you see that today.
And one of the examples that I clicked by quickly was an example that was a hybrid campaign. It was a policy change that a lactation group wanted WHO to change their policy on something. And so they used their crowd on Facebook and Twitter to draw attention to this and to lobby virtually. And I believe they were successful in doing that.
So we have 5 minutes. I just wanted to ask our panelists if they had any parting words of advice for the crowd. And then I think, Jen, you're going to make some announcements. So, Larry, any?
Well, actually, in that last issue, I would just say the usual rules also apply. If you're trying to reach policymakers, you know, to make sure you're following them, make sure you do the hard work of interacting with them before you send out messages or while you're doing that. You can't replace, you know, human interaction with anything else, and so that's the most important part. So I would say my parting word would just be know what you're doing, ground everything you do in social media in your goals, make sure your goals are really well articulated. And if you're working with people, whether it's an intern or whether it's a contractor who's writing for you, don't be afraid to direct them on what the voice should be. Your voice is really, really important, and spend some time figuring out what you think it should be.
One thing I wanted to hit on that I hit on a bit in my speech, but I want to leave you thinking about this, is crowdfunding within healthcare is just going up and up and up. And I've attended too many conferences recently where speakers have presented crowdfunding as a way to pay for patient care when they can't get it through any kind of traditional means. And that's the only way crowdfunding applies to healthcare. And that's so not true. So you do need to build a social media platform to get into crowdfunding, and I recommend you build it at least a year in advance. But I know a lot of you are with struggling organizations and agencies, and you're struggling to pay for campaigns, and truly, crowdfunding can help you so much. And not only to raise the funds to do the wonderful, worthy work that you want to do, but the buy-in. Those people who gave you money, and it could be only $20, they are part of it. And they own it just as much as you, and they will promote it. So really think about that. That's one of the number one reasons why you also want to be doing this, is because it will help your organization succeed.
And I'll just say again that if you can use social media as much for listening as you do for communicating, you will get out of it as much as you put in, because you will find your tribe, you will find your team. And I've seen it over and over. There is an altruism that is deep within all of us. Everyone wants to help. You just need to let them in and let them help you.
Fantastic. Well, thanks to all of you for what I think was a pretty good discussion.
So we get to go now.
I think we get to go.
Oh, before we...
We can go, okay.
We're allowed to go. I'm just going to make some announcements for our group here before you go off to your workshops. Our closing luncheon session we're going to be joined by Texas State Senator Leticia Van de Putte, and she's been around here at the conference at different points in time. She represents San Antonio because we had to bring in a lot of Texas voices this year, and she's a ball of energy, and she's going to be great and inspirational. The other thing that happens at the lunchtime session is we announce who won the raffle for Regina's painting. She's going to be back here painting. And so for those of you who want her to be your BFF or offer your hand in marriage, I saw that there were a few of those on Twitter. She's going to be back here painting. And then we'll announce who won the painting at our lunchtime session. Conference evaluations, we bug you about this every year. It's how we know what we're doing well and what we want to change. There were evaluations in your packet, so please fill them out, and there'll be staff people at the doors willing to take them. The other thing is, if you downloaded the app on your phone, there's the evaluation survey on your app, so you can just take it on your phone, which is great. And we look forward to seeing you at lunchtime. Thanks.